this was assigned to my committee, and I'm actually the author of the bill. So what I'd like to do today, if we could just take testimony, and then when we reach, when we have our members here, we'll go ahead and vote. And if we're juggling between appropriations and here, and we'll continue to meet as long as we can, but when we have the quorum, we may need to go ahead and go. So I would like to, if we could limit the conversation or discussion to 3 to 5 minutes, at the most. I see we have 7 people that would like to speak, and then we'll go from there. Okay. So Dale Jackson is first. If you would just come up and have a seat, introduce yourself, and tell us who you represent, where you're from. Okay. Of course, Dale, I know. But anyway, for the record, if you would mind.
My name is Dale Jackson. I have an autistic son, so I represent him. Thank you to the committee for hearing this bill, and also thank you for offering the bill in the first place. And we really appreciate that. Speaking specifically on the issue of autism, after firsthand experience helping autism families around the entire country treat their autistic child with cannabis oil, I have firsthand knowledge and experience, and I know without a shadow of a doubt that of all of the conditions, autism does require a higher than average THC percentage. I think it's extremely critical to maintain the level of 5%, and I would implore you to keep that intact. I'm encouraged that I think this bill will move forward, and we can continue that dialogue. But it is imperative that not only do we add autism, but yet we keep the bill effective for autism parents and allow that THC level to stay at 5%.
Thank you, Mr. Jackson. Does the committee have questions? Okay. All right. Appreciate it. Thank you very much. Appreciate your brevity. Brad Williams.
After all, we don't do this. We get close like that.
You're good. You're good right there.
That you?
Yeah.
Okay. My name's Brad Williams. I started taking cannabis oil about 2 years ago when the law first got passed. I was in a car wreck back in 2006, and I'm left with horrible pain, neuropathy, PTSD. I was on 4 Lortab 10s, morphine 30 milligrams, and Neurontin, and a whole bunch of other stuff that I don't need to name off right this second. Long story short, I started using cannabis oil, and I'm off of all medications now. Yeah, my medical records can be used to back up everything that I'm saying now. Yeah, it is extremely helpful with pain and psychological disorders and things like that. That's what I use it for, is like I said, the pain and the PTSD, and like I said, it has worked great. I was initially gotten on through a seizure disorder, and like I said, I don't believe lowering the THC level will benefit anyone at all. We started off, using Marinol, and I switched from Marinol to the cannabis oil. Like I said, I just really encourage you guys to look this information up. I've done a lot of homework on this, and it really helps a lot of people. Thank you guys.
Appreciate it. Any questions? And you're seizure free now?
Yes.
Good for you. All right. James Bell with Georgia Care.
Yes, thank you. My name is James Bell. I'm with the Georgia Care Project, with the Campaign for Access, Reform, and Education. We appreciate the addition of autism to the medical list. You may be aware that there is a bill on the House side that is inclusive and may introduce additional medical conditions, so we appreciate you learning more about the medical conditions and how cannabis can help. I am confused about the issue of reducing THC from 5% to 3%, and what, as I assume you're the author of the bill, what you hope to accomplish by doing that. I don't think you're going to see any scientific or medical information here that's going to suggest that moving a piece of legislation from 5% to 3% will do anything, accomplish anything. Georgia's moving forward with medical cannabis, not backwards, and I feel that this bill is moving backwards. And I represent a lot of people in Georgia. I get phone calls and emails every day, sir, from people who tell me their life stories, how THC and CBD and whole plant medicine have helped them. And we would like to hear from you why you feel we should go backwards and move from 5% to 3%, because again, I've seen no rationale.
Okay, well, I appreciate that, Mr. Williams. I'm sorry, Mr. Bell. And I apologize, I didn't bring that up in the very beginning. So the state of Georgia, initially, back in the 80s or so, was the number that was on record was 15%. It was actually never used at that time. As we have brought up marijuana for treatment of medical conditions and so forth, there are about 8 or 9 states now that have what's termed recreational marijuana, and they have no restriction on the THC. There are states that have medical marijuana that have no restriction on THC. And there are about a dozen states, of which Georgia falls in, which there is a restriction on THC and THCA and weight background. And then there are states that have not touched it completely. So of the states that the category that we fall in, the state of Georgia, we are at the higher end of that. Virginia has 7%. I think there may be one other state at 5%, but most are significantly lower than Georgia. As a matter of fact, some are even at the quote-unquote hemp oil, and which is the less than 1%. That's the logic where we are, and I know that probably doesn't satisfy you. Hopefully that answers your question. Did you have anything else?
Well, I would just encourage this committee to reject any moving backwards in this bill. 5%, quite frankly, is not enough for a lot of patients who need it. It's kind of like drinking beer. There's 3% beer, 5% beer, and 8% beer. You drink a little more of the 3% to get that effect. You might drink, 5% a little more effective. You use a little less.
I got you.
The point here is more medicine means more money to patients who already can't afford it. And we'd like to see it stay at 5% at this point. But we do appreciate your offer on the autism.
The only other caveat that I have is, to use the term medicine, and personally, I was the second signer with Representative Peake when I was in the House, and I'm glad we are where we are. But the facts is that under the Obama administration, the DEA and FDA kept it as Schedule 1. And personally, I think that is wrong. I think they, what the answer is, could they have made it a Schedule 1B to allow studies in universities, medical schools, and clinics? Would that have been a better answer than what they gave? But they kept it in a category where it has no medicinal usage. And that may not be right, but the problem is that there are no good randomized controlled trials because of the federal government. And there is no good data. They are correct on that. But I appreciate that, and hopefully that answers your question. I know that doesn't make you happy. Virginia Galloway is next up.
Well, sir, whether it's 5% or 3%, it's still going to be Schedule 1. So I just want to remind you.
Thank you.
Good afternoon. Thank you for giving me an opportunity to testify. I'm Virginia Galloway with Faith and Freedom Coalition, and I just wanted to say thank you for considering dropping that THC level. We certainly, wisdom, justice, and moderation is our our virtue here in Georgia, and we're for moderation. So also, I think it might be productive to do, I don't know if we've already done this or not, maybe you could clear that up for me. If we passed a resolution from the House and or Senate asking the federal government to change the scheduling of the drug to allow for testing in the randomized test, because I would be all in favor of that.
Yeah, I would agree with you. I'm not aware of that. Can the representative, that we're not aware of a resolution that...
there is one coming in the House.
There is one coming. All right.
The only other thing I wanted to say, I'm not in favor of adding any conditions until those tests are done, until we hear from the Marcus Center and some other organizations who work with children with autism that are professionals.
I agree. Thank you.
Thank you.
You know, I have a little trouble. Was it Greg Reduca? Reduca. Yes, I'm sorry. Let's be clean, Georgia. Let's be clear, Georgia. Right. Either way. Which one is it?
Well, thank you so much for the opportunity to be here today. It's greatly appreciated. I am Greg Reduca. I'm Executive Director of Let's Be Clear Georgia. We're a collaborative to prevent marijuana abuse. We have a 350-member collaborative around the state. My bachelor's and master's is in psychology. My doctorate is in human development from the University of Maryland Institute for Child Study. Like you, I'm very interested in helping children and youth. That's what my whole career has been about. My first job was in '74, to date myself, as a substance abuse counselor. And I helped establish the first adolescent chemical dependency program at Ridgeview Institute when THC was a lot lower than it is today. So I'm also an international certified prevention specialist. There's really a lot to that certification. And prevention is now very much of a science. So prevention, you know, just what it says, trying to stop the problem before it starts or before it gets any worse. And that brings me to being here today. As I think all of you know, 1 in every 64 children in Georgia is diagnosed with ASD. My heart goes out to these parents who I know are have gone through incredible suffering, as have the parents of the epileptic children as well. But 1 in every 64 children, 1 in every 39 boys, it's a lot of children. And we're just concerned that if word gets out that Georgia has legalized THC for autism, that use could spike because of the perception of harm going down. The scientific evidence, and there is some scientific evidence from Boston Children's Hospital and Harvard Medical, and I have in my packets today that I'll leave with you the abstract of the article and some conclusions. Conclusion from that article that parents, and this is so understandable, and I'm very desperate, and again that's been a lot of what I've been doing is trying to resolve some of that desperation, but they may be trading away their child's future for short-term symptom control. Given the scarcity of data, cannabis cannot safely be recommended for the treatment of developmental or behavioral disorders at this time. Also an article from Washington University School of Medicine, a conclusion, increased liability, elevated autistic trait scores were associated with substance use and misuse, and that study did include cannabis, with the exception of alcohol use. So we do have some scientific data that I think is so very important to consider. We want to get these children all the help they can. And I think some of the things are so important that some parents may not realize because it can be so complicated. That a child psychiatrist, a developmental pediatrician, a clinical psychologist are the ones who can diagnose this most accurately. The diagnostic criteria are extremely complex in the DSM-5, and I really think that when specialists are diagnosing, the diagnosis can be more accurate. The age range is of consequence. I've been in consultation with Dr. Ellis out in Columbus, who's an expert on this. He's polled some members of the Georgia Council on Child and Adolescent Psychiatry. What they're saying is that the prefrontal cortex does not mature until age 25. So there's not any safe age below this for the use of cannabis oil is what their phone poll has shown today. I know that the Non-Civil Judiciary Committee last year recommended use for only the severe end of the continuum for AST. Greatly, tremendously appreciate the lowering of the THC percentage, and I'm really hesitant to say this, but back in the 80s, when I was treating a lot of teenagers, hundreds of teenagers with cannabis use disorder, which is also in the DSM, the THC percentage was around 3 or 4%, and kids could still get plenty high from that percentage.
Really appreciate it. Really appreciate it. Have a question?
Thank you, Mr. Chairman. What studies were you referencing now? Is that from Harvard?
Yes, there's one study from Boston Children's Hospital and Harvard Medical, and then a second study from the Washington University School of Medicine.
And just to be clear, the bottom line of those studies is that this oil should not be used to treat any of these conditions, autism, or is that the bottom line?
Not at this point. I think they would be in agreement with the senator's mention of Schedule 1B, that it surely needs to be much more open to research. CBD is certainly showing tremendous promise in clinical FDA trials for epileptic children.
And the reasons for that would be because there's concern that it causes harm?
Yes. You know, a stoned child may look like a medically subdued child, and if a child is taking daily doses of THC, studies have also shown that there can be an IQ drop of as much as 8 points. Of course, that's going to age 38, and we wouldn't expect that here, but nevertheless, it does seem to affect cognitive functioning.
Thank you.
Thank you. Any other questions? Appreciate that. Appreciate your testimony. Thank you. Thank you. Very pleasure meeting with you earlier. Let's see. Next on the list is Rick Ward. Dr. Ward. All righty. For them. You represent American Academy of Pediatricians, right?
I do, pediatrics, yeah. My name is Rick Ward. I'm not a pediatrician. I'm the executive director of the Georgia chapter of the American Academy of Pediatrics. We have 1,800 members statewide, general pediatricians, pediatric subspecialists, etc., including pediatric neurologists. Unfortunately, with the highest regard for the chairman, we cannot be supportive of this bill today. We actually had an extensive conversation about it just last night in our legislative committee, which had about 20 pediatricians there. We also heard about a 20-minute presentation from Dr. Young Park, a pediatric neurologist at MCG, who's conducting some of the trials of CBD oil on children with epileptic seizures that are uncontrolled by medication. And those are very promising, and we were encouraged to hear that and are supportive of that. Our position has been we would be, and like you, we were disappointed in the FDA. They did us no favors this summer by keeping it on Schedule 1, because we would like to see the drug studied in other scenarios. And there is some anecdotal evidence. You just heard some earlier in the testimony from parents reporting that, but you know, my group are physicians. They believe in science. They believe in erring on the side of caution. And the scale of this, if you believe the rates on autism, about 10,000 children in the state theoretically could be on the ASD spectrum. That to us would be drug experimentation on children on a mass scale. And so unfortunately we simply can't be supportive of it until we know. Thank you.
Thank you. Any questions from the committee? Okay. All right, thank you very much. Last, if anybody got here late and wants to sign up or talk, certainly happy to entertain that. Last on the list is Perrin Cheda. Dr. Cheda?
Yes, sir.
Hospice physician. All right.
Hello. Hello. My name is Dr. Perrin Cheda. I am a physician for Wellstar. I work out in Douglasville and Paulding. And I went into high school here in Smyrna. Went to University of Florida for undergrad and medical school. I know that might not cause a lot of friends in this room. There we go. So,
Now you're qualified.
and then I went to San Diego. I did family medicine out in the University of California, San Diego, and I did my palliative care and hospice fellowship in West Los Angeles. And I returned back to Georgia to live closer to my family. So I'd like, I might take a little bit of time, I hope that's okay, but I'd like to tell you a story about a patient that I dealt with about 6 months ago. I was at Paulding Hospital and was called to see a 44-year-old female who was making statements that she was ready to die. And I went and saw her, and she had a problem with her gut. And it just wasn't working properly to the point where she could no longer eat without causing extreme pain. She was in and out of the hospital constantly, and now was requiring IV nutrition through her veins. She looked at me and she looked at her husband and said, "I cannot do this anymore. I am tired and I am ready to die." And I was there when she looked at her husband in the face, held her hand, and they both cried together because they had decided that this existence was no longer possible, or she could not live this existence anymore. In my interview with her, I talked to her and she told me, "The only thing that seems to help me is smoking pot. Can I do that on hospice?" And I told her, "Ma'am, you go home and smoke all the marijuana you want if it makes you feel better." And she left to go home to die. And I thought that would be the last time I heard from her. 2 months later, I'm walking around the hospital and my nurse practitioner says, "I think you're going to be surprised to see somebody." Lo and behold, I come around, she's visiting someone in the hospital. She's gained 20 pounds and she's going to graduate off hospice. And I asked her, "How did that happen?" "I've been smoking marijuana." Nobody can sit here and tell me that marijuana does not have medicinal benefit. It does. I've seen it. I've lived it. In California, when I used to take care of hospice patients and they used to come to me in clinic, I had to start them on opiate medication. They come back to me and they're using less. And I ask them, "What have you been doing?" "I've been using marijuana." I'd like to also say that marijuana is not a panacea. It does have side effects, like every other medication, morphine included, Haldol, fentanyl, oxycodone, Norco, Percocet. They all have side effects. And in fact, morphine can cause delusions, hallucinations, and myoclonic jerks. So there are other medicines that have bad side effects. We still use them because they can help patients. I know that we're talking about autism here. My wife is a pediatrician. She graduated of the UCLA residency program and works in East Cobb. She agrees with me that medical marijuana has benefits for certain populations. It's not going to work for everybody, but it can work for some people. And let's talk about the pharmacology a little bit. 5% to 3%. Does it make a difference? It's an arbitrary designation. If I want to give somebody 20 milligrams of morphine, I could give it to them in 1 pill. I could give it to them with 4 pills. The same logic applies to a percentage of cannabis use. You just have to use more. I wanted to just address something about what somebody says, a couple things. About autism spectrum. There's a lot of research out there with poor cognitive development of autism spectrum. Yes, adolescents should not chronically use marijuana because it does inhibit brain development. That's a fact. However, let's balance that against the idea that if someone is seizing all the time, or they can no longer interact with their family, other parts of their brain do not develop. Let's not confuse everything with a simple study. My last thing. Wisdom, justice, moderation. It is not wise, in my opinion, to deny patients, dying patients especially, an opportunity to continue to interact with their families and be pain-free. That's not wisdom, nor is it justice. And I'm coming here because I told that patient that I talked to you about that if I ever had the opportunity to advocate for patients like her, I would do it. This is why I've taken my time off from being in the hospital to be here with you today. And the last thing, I talked to everybody in the hospital. Everybody in the hospital at Douglas and Paulding are behind it. They support medical marijuana. Thank you.
Thank you. Any questions from the group? Okay, thank you very much. Appreciate it. And I got a note that Mr. Jackson, you'd like another 60 seconds.
Thank you. I will be just as brief as I was the first time. I forgot to tell you the most important story of my life. And after hearing the others mention the IQ, last March, my son could not feed himself. My son could not sit in a restaurant and have other people around him making noise. So therefore, my family could not go out to eat and enjoy a dinner together. My son could not communicate with me in any way. As many have witnessed over the past year via Facebook, my son and I can now communicate for the first time. He'll be 9 next month. Just last week, I sat down on the floor in the living room across from him, a good 15 feet away, and I asked my son to come to me. And he recognized me. He recognized that request. He walked across the room and he gave me a hug. He turned around and went back and continued playing with his toys. So we can talk about a possible 8% reduction in IQ. I can show you real world evidence that I can now communicate with my son. I'll take that 8% reduction in IQ if my son can learn how to tie a shoe and feed himself and go to the bathroom himself. Thank you.
Thank you, Mr. Jackson. Is anybody else? Thank you. Senator Miller, any thoughts? Thank you for being here. So I'll entertain a motion from the committee.
I've got an amendment I want to present to the committee. On line 24, after autism spectrum disorder, delete the period and add comma when such diagnosis is made for a patient 18 years of age or older. And obviously this is in response to what I feel is compelling testimony about the possibility of use in children. And you know, the story that was just told about the severe disorder is obviously very, very compelling. My concern, though, is folks that would be at the other end of the spectrum thinking that this might be a panacea, and until the studies are done, I, as a physician, just am not comfortable moving forward in that manner. So that's an amendment.
Got a second? Second. Okay, we have a second. So all those in favor of the amendment, say aye.
Aye.
Okay. And those say no. No. And so the amendment passes, and so we have that amendment. Do I have any other motions?
I have one.
Okay.
Mr. Chairman, when we first started talking about medical marijuana in Georgia, and really with the oil, we were all told that, well, it doesn't have any of the THC in it, and that's not the operative element of it. And so we moved along with that, and then all of a sudden it changed to where the discussion was around a 0.5 percentage of the THC. And then before we knew it, somehow it was in the bill where it went to 5. When you look at Georgia in comparison to the other states except for 2, every other state is below 1. And you know, the average may be around 0.5, 0.6. I have averages, but that's where it is. And you know, in my opinion, in view of what I'm hearing from the doctors and from these studies and concerns that they have, until we know what the science is and we know what it's going to do, I mean, I don't think anyone is against using drugs or to treat conditions when it's controlled, when it's studied. when you fully know what the side effects are. But we don't know that here. So I would move that we change the 0.3, the 3 to a 0.5, back to where we originally were.
So you're making that as a motion,
Right.
so
On line 14.
from 3% to
0.5.
to 0.5. You hear a second? Motion fails by lack of a second. I'll entertain any motions for passage, maybe?
Motion to pass a committee's with that changes that I designated earlier.
With that change, autism spectrum disorder, when such diagnosis is made for 18 and over.
Right.
Is that accurate? Okay. Do I hear a second?
May I offer a medical opinion?
No,
Because
I'm
that
sorry,
doesn't
it's
make
a
any
little
sense.
bit out of order, but I appreciate your thoughts. So I'll second the motion. All those in favor say aye. Aye. All those in favor?
No.
No. So the bill passes 2-1, and thank you very much.